Hello, hello, hello. Welcome to my channel. This is Dr. Ray. If you've been here before and subscribed, thank you. If you're new to the channel and you haven't subscribed yet, please subscribe. Hit that subscribe button below, down there. And if you have been on my channel before, please like and share this video. I greatly appreciate it. So I did the Breast Cancer Awareness 2020 video, and I did get some questions and some comments, and so I wanted to address that in the video today. So I want to share with you all a little bit more information about Breast Cancer Awareness 2020, show you a couple of slides and a little bit more information, and move on from there. So before we get too much further into content, I want to share with you that 1 in 8 women in their lifetime will be diagnosed with breast cancer. Over 276,000 women will have a diagnosis of an invasive type of breast cancer, while about 48,000 women will be diagnosed with a non-invasive or less aggressive, usually, type of breast cancer. And it's been estimated that 2,700, close to 3,000 men will be diagnosed with breast cancer in their lifetime. So let's go over some structures of the breast. So this is the breast, and there's a couple structures here. Please bear with me. I'm not really accustomed to doing this yet. We're working through it. But this is the anatomy of a female breast, structures of the breast, and we're familiar with that, but I want to talk about it in relationship to breast cancer. So with the breast, you have a muscle underneath, the pectoralis muscle, and over that are some lymphatics, those green things here. That's what represents the lymphatics, and it has little knobs in it, and that's what we call lymph nodes. As the lymph nodes go down, they start here, kind of close to the collarbone. They go over to the axilla or the armpit, go down into the breast and tissues. Some other things that are involved with the breast are the ducts. The ducts are the white things here that look like rivers going towards the center, going towards the nipple. Then you have these structures here. These are lobules. Lobules that are the structures that are responsible for developing breast milk when we lactate. And then the lobe is those two things together. The duct tissue, the lobule, and the fat, that's called a lobe. So it is a functional unit in the breast. And between all of that and holding it all together is adipose tissue or fat. So with all of these, including the nipple and the areola, so the nipple is the area that rises above the breast structure, and then the areola is the darker portion. So you can see here in a cross section, we have the rib, you have the muscle between the rib, and you have, the chest cavity on the inside, so that's going towards your lungs. And then we have those structures on the side. We can see the lobule at the top, the ducts going down, the areola, the nipple, the lobe, which is that functional union that we just talked about, and then the adipose tissue, which gives the shape and all of that. So all of that together is called the chest wall. Now, we talked a little bit briefly that there's 2 main types of breast cancer. I mean, you can go into the cytology or the cell characteristics, right? But mainly it's, if you want to think of it in 2 main categories, it's invasive, which means it might start one area, but it's not going to stay there. It's going to move to other areas. So you have invasive, which is the 276,000 plus women I was talking about that will have invasive. So it can start in the lobule, it can start in the lobe, it can start in the skin even, but it's going to move to other areas. And then you have the non-invasive. So that's the type I was saying with the 48,000. And non-invasive generally is more of a change you see with time. Okay, so we have different things in our body, and interestingly enough, our breast, our mammary glands, I know it sounds so unattractive, um, but the mammary glands, because of the adipose tissue, is kind of a detoxification point. And so with it being a detoxification point, you might see some calcium, little bits of calcium that go on. And with a period of time going on, you might see that turning into a cancer-like structure. But those tend to stay in the ducts. So when we're talking about non-invasive, we also use the words in situ, in second word, situ, situ. So you have invasive that can be anywhere. It can go to the muscle, it can go to the rib, it can go to the muscle here. It can go anywhere in the body, including an older lady who told me, unfortunately, she lost her daughter last year because she had such invasive breast cancer, and had even made it to the brain. So all of these structures are where we see breast cancer when the breast is the origin of the cancer and the diagnosis. One other thing I wanted to show you is the actual photograph of a mammogram here. We'll get that up there. Okay, so this is what a mammogram looks like. So it goes all the way, it is a digital image, and it takes stereotactic images of the breast, of the skin tissue, and as far as I know, this is a normal mammogram. I'm not trying to show you cancer in a mammogram. You can see some of the duct-like structures. You can even almost visualize the lobules up here, and then it's going down to the areola and the nipple. So these are the two breasts side by side with a little bit of the chest wall included in the middle. And then this is purely just the lobes of the breast, the right and left. I'm not really sure which side is which side because you really need to have it labeled, and it's not labeled in this one. This is a stock image. But those are the two images of the breast, one on each side. And the radiologist, and I'm not a radiologist, the radiologist would take a look at this and determine if all of these structures and all of these areas look normal. And like I said, this mammogram, I'm not trying to show you a cancer at all. This is just what a mammogram would look like. It's a digital representation of the breast tissue structures. It can even get as underneath the breast tissue itself to the muscle. It can be a little bit more of a challenge if you have breast implants. So that's one of the things that can make you slightly higher risk because it can make it difficult to get good images. The other thing is, the younger the woman is, the more difficult the images can be because the breasts are so dense. So you might not really get a good overview of what the tissue everywhere looks like, because there can be normal density, not anything wrong with that, absolutely normal. But younger the woman, that sometimes the harder it is, they might have to use ultrasound in addition to mammography, or they might have to do additional imaging tests in order to really see what's going on. If you saw my Breast Cancer Awareness 2020 video that I released just a little while ago, one of the things that we talked about was a tool that helps us do our monthly breast exam. We should be doing one at, once a month, whatever is the best time of the month for you, hopefully sometime in the month consistently, and then keeping a record of what you notice, and if anything changes, you're concerned, you would get to your medical care provider and make certain that you get the proper care that you're supposed to get, because early detection saves lives. I can't stress that enough. I can't repeat that enough. But this particular thing is a medical aid in order to magnify the sensation of your fingertips. So it acts almost like a magnifying glass for your fingers when you're doing your monthly breast exam. So we know that early detection saves lives, so it helps us hopefully do a more thorough exam and therefore decrease time to diagnosis. Now, I have to say, this is not an FDA approved medical device. This is an aid. So we can't say that it cures, treats, prevents, or cures any kind of disease. But this is a good aid to have at home. Go back to my first video because I actually take this out of the package and I show you how it would be used. The other thing that I talked about in my first video is that we currently have a special on these, that it's buy one, get one, and it's already a discounted price. And definitely something that is a huge benefit, could be very useful to make certain that you are getting your best results as far as detecting any changes in your breast tissue. So that's what I have here. It is by Plexus. That's my company. Breast Check, check without two C's, one C, CHEK, the breast self-examination kit. So if you did not see my first video, make certain to see that one. I actually take it out, kind of show you how that works. But I wanted to kind of go through the breast structures, invasive, as opposed to non-invasive, also to what a normal mammogram looks like, and also talk about that magnifying tool for the fingertips of your hand when you're doing your breast exam. And then also too, I would be remiss to say that the only thing we're looking for is just the breast tissue itself. You also want to look at the skin of your breast, if there's any changes there. If there's any change in the appearance of your nipple, that the nipple has gone in, or what we call inverted. If you're seeing any lumps before you even feel, that's my facts, excuse me, before you feel anything, but any changes from your normal, you want to make certain to get those followed up on with a medical care provider. It is critical. If you have any questions, if you have any comments, if you would like any particular content on my channel, please let us know. My email is on my YouTube channel header. Also too, it's in the links below, and also in the links below I have the information for signs and symptoms of breast cancer, and the next video in this series is going to be life after breast cancer, and it's my personal story. I'm a breast cancer survivor. It'll be 10 years this December. So this has been Dr. Ray. I am your #1 gut health strategist, wellness activator, and home-based business mogul coach. You deserve to be in your best health, and it starts in your gut. Yes, your gut. I help my team members and clients take control and optimize their good gut health benefits so they can have better moods, sounder sleep, and a higher quality life. We do that with our plant-based nutritional products and next level concierge coaching services. I will see you next time. Bye-bye.